Hello, I'm Dr. Juan Brou, a board-certified plastic surgeon here in Oklahoma City. I'm the owner and director of Premier Plastic Surgery and Aesthetics. Today, we're going to talk about the tummy tuck journey. I encourage you to stay to the very end of the presentation because we're going to have a very good question and answers part. I want you to submit your questions if you have any through the chat, and our plastic surgery team will be happy to answer them. All the attendees that stay to the end of this presentation will qualify for our giveaways. And we're giving away Cytone treatments, which is a combination of lasers for rejuvenation. And that's going to be great. And so the first topic we're going to talk about is the tummy tuck the right thing for you? And that's a very good question because there's some people that are not sure, and there's some other procedures that could be adequate for them. Now, typically, a tummy tuck is done on patients approximately from their mid-30s to mid-40s after they have had their children and they're ready to modify their bodies so we can get back to where they were before children. And part of that is going to involve the treatment of the abdomen, which is probably something that gets distorted mostly from pregnancies. So typically, the patient that will come to see me is something, even though it can be from mid-20s or early 20s, all the way to 50s or 60s. The main reason why they come to see me is because they want to modify that damage that occurred with pregnancies. Sometimes it's a combination of pregnancies and massive weight loss, or weight gain and weight loss. So all those combinations can be affected. They can affect your tummy, and therefore you want to have something to correct that, which is what I do. Okay, so tummy tuck can be a variety of procedures that involve, number one, liposuction. Liposuction is designed to correct some of the contour deformities. Also, trimming of the damaged skin, which usually happens in the bottom part of the belly, and get rid of scars such as C-section scars, and also to correct the abdominal muscles. The abdominal muscles oftentimes get separated during the course of a pregnancy, and therefore, in order to have a nice flat tummy, we need to go and correct them. Of course, everybody that comes to see me for that reason is evaluated to see if they is the proper fit, and the patients normally have to be healthy and in good condition. Now, how I do this has to do with what the issues the patient brings. And for instance, if somebody has large weight loss in excess of 40 or 50 pounds, the requirements are going to be different from somebody that is close to their ideal body weight. And so sometimes the only thing we need to address is the damaged skin, sometimes the damaged muscles, and sometimes is reducing the adipose tissue, that is via liposuction. A tummy tuck is a fairly involved operation, and it takes some time to recover from. We make sure that you have the correct amount of compression after surgery, and that you don't collect fluid or have problems like that. And in general, most people recover well from a tummy tuck in 2 weeks. So the first week is probably the worst part, where you're going to have a little difficulty getting around. But then in the second week, you're going to be able to walk straight and move around well. At this point, you're probably not going to take pain medication anymore, and you can do some mild housework or work through a computer if you do that. So by the end of the second week, you're going to be able to do most of your daily activities. You'll definitely be taking care of yourself. You can shower and you can start walking outside of the house. For people that are more active, that tend to go to the gym and exercise, 1 more week is probably a better amount of rest before they start engaging in light gym activities such as getting on the treadmill or lifting the minimum weights. And the trick about getting back to normal is to do it gradually. Well, in order to heal properly, obviously the number one thing is the proper nutrition. So when we talk about nutrition, we're talking about adequate source of protein, fiber, vitamins, etc. And if you take supplements, it's perfectly okay to do that. Then I ask my patients to stay in the compression garment for about a month. And generally after that month, things are going to start looking like the final product. Now, there's still some swelling to be resolved, and sometimes the glue on the stitches starts to come off then. But people expect to be normal at 3 months after surgery. And that's when we take our first set of photos afterwards. The biggest benefit of this operation is the contour and the features of the abdomen. Now, oftentimes we also do liposuction of the lower back or upper back. Sometimes we do fat grafting to the buttocks if that is going to be a good complementary thing. But the idea is to reaffirm and bring out all those features that characterize a nice, good-looking abdomen, enhance the waistline, and restore that curvature of the female body. So thank you for staying all the way to the end. We're going to notify the winners of our giveaways via phone. Don't forget to send your questions and call us if you decide to come see us.